Hi, folks. Kim Perrotta here. I'm with Chase, creating healthy and sustainable environments, and I've recorded this presentation several days before our event today. So I'll be hearing it along with you, which is a little bit strange. And I just want to thank the New Brunswick Lung Association for inviting me to speak with you. A little bit of information here about Chase, creating healthy and sustainable environments, the organization that I've actually founded and am currently working with. So just a little reminder about why we're talking about climate change. Many of you will remember that back in 2015, we finally got an international agreement on climate change. We all refer to as the Paris Agreement. And that was a huge step forward. 195 countries actually agreed to hold climate warming well below 2 degrees, and to pursue efforts to limit global warming to 1.5 degrees. Now, around like right now, global warming is hovering around 1 degree. So many of the impacts that we've seen over the last, several years, last decade, are a result of that 1 degree of global warming. So just keeping that in mind. Now, if we continue to emit climate greenhouse gases at the current rates, then it is expected that we will exceed 1.5 degrees within 10 years, and that by the end of the century, we would be at 2.6 to 4.8 degrees of warming. And many people have said that that is simply a planet that is not habitable for human beings. So climate change is already a global health crisis. We're very lucky in Canada. One, we're a very wealthy country, so we have lots of municipal infrastructure and emergency procedures and healthcare in place so that when we have an emergency, we can respond very quickly, and there's a lot of support for us. But we're also just lucky geographically that many of the hardest impacts have been felt by other countries, and those have been island countries or those that have a lot of people living along the coastline, and those that are already struggling with drought and providing enough food for their population. So it tends to be that those of us in the wealthier countries are those who are most biggest contributors of the greenhouse gases causing climate change, and the people that are the poorest countries are the ones that are being the hardest hit by it. So right now we know that, for example, in 2017, there were 712 extreme weather events, and those were valued at, the costs associated with those were valued at $326 billion. That's just 1 year. That's not looking at the health costs. That's just the actual cost from some of the damage. So we know, for example, that the Lancet Countdown Report on Climate Change and Health in 2018 estimated that 157 million more people were exposed in 2017 to heat waves than were in 2000 as a result of climate change. So just kind of, that gives us like just a little statistic to try and get a sense of just what climate change is already meaning for health risks on the planet. The other thing that the Lancet Countdown had concluded was that undernutrition, starvation, malnutrition would be the largest health impact of climate change in this century. So the difference between 1.5 and 2 degrees of warming is significant. The Intergovernmental Panel on Climate Change, it actually spent a few years looking at like modeling and trying to figure out what the different impacts would be on human structures, on human health, on ecosystems around the world, and came out with an 800-page report in 2018 that really compared the difference. And basically what they said is 1.5, would be very, very significant. We'd see in like all the impacts that we're seeing now would all be amplified. But what they describe with 2 degrees sounds like it would be absolutely devastating, that would be so much greater in terms of ecological systems and human health. So there is a very strong view now that we really need to keep global warming, we need to limit it 1.5 degrees. And in order to do that, the Intergovernmental Panel on Climate Change feels that we need to cut globally climate emissions by 45% by 2030, and we have to get them down to net zero by 2050. So we are talking about a huge amount of work, dramatic changes, significant cuts that we need to make in a very, very short period of time. Now, one of the things I want us just to remember is Canada is actually one of the top 10 emitting countries in absolute terms. It has been for decades. And so many people feel that countries like Canada and the United States and Australia that are both wealthy, but also they're really heavy emitters should actually move faster to cut their emissions than other countries. In terms of health risks for Canadians, I've kind of grouped them into kind of three different categories. In terms of extreme events, we're seeing that many weather events, extreme weather events, are becoming more frequent and more intense. And so we're seeing hotter weather, we're seeing longer heat waves, we're seeing extreme heat that goes on for a longer period of time. We're seeing heavier rainfall, heavier snowstorms. We're seeing hurricanes that are more intense. We're seeing tornadoes in areas where we never used to see them. And these are giving rise to more droughts and to more wildfires, and those wildfires are more intense. And they're also giving rise to floods and storm surges, and again, more frequently and more intense than we've seen before. And then in terms of the health risks that these present for Canadians, they can result in injuries and death right away. They can result in power outages and damaged infrastructure that then cuts people off from food, from water supplies, from healthcare. They can contaminate drinking water and crops. They can produce extremely high levels of air pollution. We've seen this past summer and a few summers ago with the wildfires on the West Coast, that we had air quality health index readings in Vancouver and Calgary a few years ago that were 10 plus, actually off the chart in terms of the level of air pollution. And we're talking about levels that will put people in the hospital, that can actually result in premature deaths. And there could be long-term impacts for people from these exposures today in terms of their long-term health. That we're not clear about. There's not as much research on that kind of thing. These extreme events are requiring evacuations. This results in financial losses and dislocation. And all of this is giving rise to anxiety for people, to depression, and to PTSD. So a number of these things have been, well documented. The other kinds of health risks are associated with the changing climate. So just, the increasing temperatures. And so with higher temperatures, we know that we can expect to see higher levels of smog, more pollen, more spores in the air, which can be very difficult for people with asthma and allergies. We know that vector-borne diseases such as Lyme's disease and West Nile virus are now starting to spread to other areas across the country. And we also expect that there'll be new vector-borne diseases that will kind of be emerging and being introduced to Canada. We know that the higher temperatures are melting permafrost in the north. And this is, the melting permafrost is causing all kinds of problems with structures, but it's also reducing access to traditional foods for people who live off the land. We know that it's melting ice roads, and that's interrupting food supplies from the south. The higher temperatures are encouraging algal blooms that can increase the risk of shellfish poisoning. And again, there have been a few studies that have looked at what the changing climate's doing to people. And again, those few studies have suggested that's increasing anxiety. It's resulting in depression and sometimes in the use of drugs and alcohol. And this has been particularly so in a few Indigenous communities that have been examined, where people live closer to the land. So the health risks for Canadians are unequal. We know that climate change amplifies health inequities and vulnerabilities that already exist. So we know, for example, that many disadvantaged populations already are at greater risk for poor health outcomes. They have a greater risk for chronic diseases and for premature deaths. And so what climate change does is it actually puts these people, at greater risk. For example, people on low incomes are more likely to live in high hazard zones for floods. They're less likely to have insurance if there's any damage to their homes. It's more likely they're more likely to experience food insecurity because of disruptions or financial costs. They're more likely not to have air conditioning. So just a few examples. We also know that low-income populations, at least some of them that have been examined in Canada, that they're more likely to be populations that are racialized. And so what we have here is, these populations being more heavily impacted. We also know that certain groups of people are simply more sensitive to the health impact, the health risk associated with climate change. For example, older people, people with pre-existing health conditions, and very young children are very sensitive to air pollution and to extreme heat. So those ways. And again, as mentioned earlier, Indigenous people in northern communities, remote communities that live off the land are feeling the impact more so than others. So just very briefly talking about the sources of climate emissions in Canada. As you can see by the blue line and the brown line at the top there, the two big sectors in Canada are the transportation sector and the oil and gas sector. When we talk about the oil and gas sector, that's not the use of oil and gas, that's actually the extraction and production of oil and gas. So this is why we see so much kind of antagonism or kind of controversy surrounded with investments in things like oil pipelines or gas pipelines. You see the red line, that's the electricity. You'll see that it peaked at 2000 and it's come down substantially. And that reduction in the electricity sector is largely resulting from the phase out of coal-fired power plants in Ontario, and the trajectory downward, that's reflecting the fact that we now have phase out legislation in Alberta, and we also have Canada-wide regulations that are supposed to encourage the phase out of coal-fired power plants and eventually natural gas plants. So for New Brunswick, the heavy emitters, the heavy sources of emissions are the transportation sector, the electricity sector, that would be the use of coal plant in New Brunswick, and also the extraction of oil and gas. So health benefits are actually associated with a number of climate solutions. And I feel like as health professionals, this is a place where we can be really influential. If we can kind of come out in support of actions that will produce fairly immediate health benefits at the same time that they help to reduce greenhouse gases, then that's a place where we can be very helpful. And so just to point out number of the health benefits associated with climate solutions, the first one is improving air quality. I think the people on this call will know that air pollution continues to be a significant burden of illness for Canada, and continues to kind of create a number of health impacts and very expensive for us from, in terms of the health-related impacts. And so some of the climate solutions that reduce air pollution: encouraging the use of public transit, cycling and walking, creating transit supportive and walkable communities that foster those two activities, the electrification of vehicles, and the shifting to renewable energies, increasing the energy efficiency of our buildings, of our workplaces, of our homes, energy retrofits on existing buildings and workplaces, and then reducing the extraction of oil and gas, which itself also produces quite a bit of air pollution. The other health benefit associated with some climate solutions are increases in physical activity. And again, physical activity, as we know, is associated with all kinds of health benefits, mental health benefits, physical health benefits. And again, very expensive for us as a society, in terms of, just lost time and healthcare costs, and as well as just, loss of life and chronic diseases that people will experience. The climate solutions that foster physical activity, again, use of public transit, cycling and walking as modes of transportation, and walkable and transit supportive communities. And lastly, the health benefits associated with plant-based protein diets that are rich in plant-based proteins. So we know that obesity increases the risk of premature deaths and cardiovascular disease and premature deaths. And again, very expensive for us as a society, both in terms of harm to human beings and families, but also in terms of health-related costs. There's been quite a bit of research done by, again, the Lancet Commission on Food. It actually found that we could actually reduce global mortality by 6 to 10% by getting people to shift their diets towards plant-based proteins and moving away from diets that are heavy in meat proteins. But there's also been quite a bit of research in the climate field where they've actually found that the production of meat, particularly red meat, is very intensive in terms of carbon emissions or climate emissions. So that's another area where we can kind of find kind of the dual impacts. So what roles are there for health professionals? One, we can collaborate with allies on common goals. So those areas where there's kind of health co-benefits, it's really helpful if we can kind of come out and say to decision makers or say to the public that, when we go for bike lanes or we want to invest in public transit, that those things are good for human health. And for decision makers, they really like policies and investments that actually produce multiple benefits. Oh, it'll reduce taxes, it'll reduce greenhouse gases. Oh, and it also reduces air pollution and human health impacts. Decision makers like that. So for us to kind of come on board and bring those health co-benefits on board is really helpful. So again, a number of the areas that we can collaborate are the ones that kind of articulated already. The other thing is just educating the public. Well, it's clear to many of us that climate change is a public health problem. It's not that clear to the public. So for us, it's just really helpful to just kind of reinforce that message over and over again with the public that climate change is not just an environmental issue. It is, the most significant public health issue of this century. And so for them to hear that from health people saying that climate change is harming health directly and that the impacts are just going to get greater exponentially over time unless we get it under control, that's really helpful. And also again, just helping people to understand the things that they can do to protect themselves and the things that we need to do collectively to protect people from the climate change that is now inevitable, but also to reduce our impact on the climate change. Health professionals, we can also get involved in climate risk assessments and processes that are directed at community resiliency. So, for us, we know now that there's a certain amount of climate change that's going to happen. We need to minimize the risk for human health in our communities. And so it's really important to really recognize, have processes where we identify what those risks might be, and then we actually develop plans to prepare for them and put structures in place or practices in place that we need to, so that when those events come, we minimize the harm to human health as well as to property, and that we're properly prepared for it. But it's also really a good time to look at what are the policies or programs that we can encourage that actually just make the community more resilient, so that when some sort of extreme disruption happens, that as a community we're flexible, we're nimble, there's other ways to get around other than just cars, or that we actually have community gardens where we can provide some local food for ourselves if there's a shortage of food supplies moving across the border, that kind of thing. We can also do that for healthcare facilities if we have relationships, if we work inside healthcare facilities, or if we have some sort of relationship with healthcare facilities. Hospitals are actually heavy contributors of climate emissions in Canada. And so again, hospitals need both to look at what they can do to reduce their emissions, to become more energy efficient, to reduce their climate emissions. And on the other hand, they also need to see what they're vulnerable to. Are wildfires expected? Are floods expected? Are they prepared? Do they have a plan that they can, implement right away, and that people know what to do in the case of a wildfire or a flood or some other event? And then just point out here that while I was working for CAPE, the Canadian Association of Physicians for the Environment, last year, I actually produced and edited a report for CAPE that was funded by the Climate Action Fund. And we called it the Climate Change Toolkit for Health Professionals. It's 8 standalone modules and 7 fact sheets. You can kind of get it as all in one kit, or you can kind of just download the modules separately. It's available in English and French, and it's open access. It's on the CAPE website. I'm providing a link here through the Chase website because sometimes it can be a little difficult to find on the Chase website. It's a little bit deep. And then, so the modules, there's one on the climate science and the commitments and international agreements. There's one on the global health impacts of climate change. Module 3 is on the health risks for Canadians from climate change. Module 4 looks at the different emission sources in different regions and like different territories and provinces. And it looks at the trend over time so that people have that information for their area. Module 5 looks at the climate solutions that are actually associated with immediate health benefits and kind of references some of those arguments that could actually be used by health professionals to support various climate solutions. Module 6 is really about trying to, taking action at within a healthcare facility. So kind of looking at both a sustainability perspective, but also how they prepare for events that might be coming. Module 7 looks at the things that we can do within our own communities to increase our resilience to disruptions, but also the programs and practices that we can put in place that actually minimize health impacts for residents. And then module 8 talks about a number of ways that health professionals can engage in the issue, either in their workplaces or as volunteers. So that's it. Thanks very much.